I'm Dr. Imran Ali. I'm a resident physician at Yale New Haven Health, Bridgeport Hospital in Bridgeport, Connecticut. Well, I always was interested in medicine, but I'm also interested in the human aspect. And I've dealt with families, and I've dealt with people who are undergoing amazing challenges. And cancer, I believe right now, is really, we're seeing more of it, and we're seeing families affected by it. More so than the patients, they always tell me, how do I tell my mom about this diagnosis? How do I tell my brother? So it's not only the patient who is affected, it's the families. And palliative care and oncology, they go hand in hand. The American Society of Clinical Oncology actually at the last meeting actually stressed the importance of involving palliative care and what we call supportive oncology during the time of diagnosis. Because when the patient's diagnosed with pancreatic cancer, we have warning rounds. A group of doctors, we get a new admission. So we do the CT scan, we look at the images, and we say, oh no, this guy has stage 4 pancreatic cancer. And that's the kind of attitude people have, oh no, as if we have to surrender. There's nothing we can do. Yes, pancreatic cancer is a very aggressive tumor. Very, very low survival rate once you're diagnosed with stage 4. But the attitude of, let's give up, I don't like that. If we were to really look at the numbers, this is, as Mr. Wright says, an emergency. This is almost like an epidemic, something that we need to address by increasing our efforts, increasing our resources. I mean, basic epidemiology, basic public health 101, when you have a disease that is spreading so rapidly, affecting so many people, you divert resources. You sit down in an emergency operations center, like here at CodePurple, and you try to figure out what's the best way to move resources so we can address the situation in a faster way. I've always been a great fan of Mr. Wright and what he did for NBC, turning it around back in the 1980s and into the 90s. And at several events, I met with the Wrights, and Suzanne knew how much of a fan I was of NBC, so she sent me an NBC Sports baseball cap and a wonderfully handwritten letter. So beautiful, so honest, and very, very gracious of her to do that. And I was just very touched by that. And then when I heard about her illness and how I was starting my residency. I was so busy starting a new job. But then I realized the news, I couldn't believe it. I was shocked when she succumbed to pancreatic cancer. But then I saw the courage and the strength that Mr. Wright had to really, turn her passion, as she was often called the chief passion officer, to turn that passion into some action. When I hear Code Blue, we drop everything and we go to rescue the patient. I think now the time is to, hear the sound, CodePurple, and time to rescue the science that's been stagnant and try to help these families which are devastated. Prevent the next generation from not having to deal with these kind of devastating cancers, specifically pancreatic cancer. CodePurple, demand a new approach.